Well, hello everyone. I'm back. I don't know what happened. The video is going, but sometimes it goes like that, right? It is still Happy Monday. So we're going to try it again. Happy Monday to everyone. Glad to have you. My name is Angela McGowan. I'm your professional healthcare advocate and caregiver strategist, author of this book, What You Don't Know Could Kill You, How to Get Out of the Hospital Alive. All right. And I'm the founder of Angie's Pace, patient advocates committed to excellence. So good morning to all of you. I'm glad that you're here. Hello to my replay viewers. We are in September, what is National Everything Awareness Month. So there's quite a few things we're going to be covering all throughout September. And let me just remind you right now that on Sundays, say it's Sunday, 5:30 p.m. Pacific Standard Time, I am covering Alzheimer's all this month. We started part 1 yesterday, and that was what we will be covering. It is World Awareness, World Alzheimer Awareness Month, and World Alzheimer Awareness Day is September 21st. So just want to let you know. And then, of course, during our regular broadcast during the week, we'll be taking on, and as I say, unpacking September, because it is loaded with different months for awareness, prevention, and to help you do what I always say: understand and believe that excellent health care, it's not a privilege, it's your absolute right. And I want all of us to go out and exercise our right and adhere to our responsibility about seeing about ourselves and getting great health care. So we're going to be talking about the blood cancers, and that is leukemia and lymphoma. There is Hodgkin's lymphoma and non-Hodgkin's lymphoma. But the bottom line is these are cancers that affect the blood, the bone marrow, and the lymphatic system. So let's talk about that. I want you to know how prevalent it is, and that is that every 4 minutes, and we're speaking in the United States, not globally, but every 4 minutes, someone is diagnosed with leukemia or lymphoma or another type of blood cancer every 4 minutes, every day. And so because we've had a lot of research advances, and because there is more government funding coming that way, that they are successfully able to overcome a lot of the conditions and manage the symptoms that these blood cancers cause, and allowing the patients to have a high quality of life. And the Moffitt Hospital, Moffitt Cancer Center, is one of the top 10 hospitals in the United States. And so I have gone and gotten a lot of information from them, and let me just share information that you can get. This is their phone number, and that they are top 10 hospital. They say, of course, in all cases, early detection is the key of achieving a great outcome. And that is why we need to get our physicals and not just go in there, just give me a little bit. No, but get complete physicals with all the tests, especially those that are age appropriate. And then go into our doctor's office. If there's something going on, speak on it. Don't expect he or she, as our physicians, to get it by osmosis. So the United States Congress did designate September as the National Leukemia and Lymphoma Awareness Month, because they want more people to pay attention and to give to these organizations, and detection is better and better outcomes. So let me give you a definition of what leukemia is. It is a type of cancer that affects the white blood cells, which help fight body infections. This condition originates in the bone marrow, okay? That's the soft, spongy surface that's inside the blood. That's where the blood cells are produced. Once formed, these cancerous cells can spread to the blood and circulate throughout the body. Of course, they're the blood cells, and the blood goes everywhere. There's no restriction there. So early signs of leukemia often are difficult, okay, to recognize, because they tend to be like flu symptoms. This is what I tell you. Remember, you don't have MD behind your name, go to the doctor. So fatigue, loss of appetite, unexplained weight loss, frequent infection, easy bruising, dizziness, fever, all of these things are symptoms of and a lot of stomach pain. Here are some things you know about lymphoma. It's a type of cancer that develops in the infection fighting cells of the body, the immune system, okay? Two main categories, a Hodgkin's disease and non-Hodgkin's lymphoma. So here are the symptoms that both fall into. Exhaustion, again, loss of appetite, night sweats, okay? So of course we might be thinking, ladies, that is menopause, but add that to shortness of breath, swollen lymph nodes around your neck and the abdomen and groin area, fever, and of course, unintentional weight loss. You just wake up 10 pounds lighter. So if you have those symptoms, don't be necessarily alarmed and think that you have it, because as I say, they mask as other things like the flu. But if you're having these symptoms, now that you know, go to the doctor. Go to the doctor, explain your symptoms, and make sure that you are clear on how long the symptoms have happened. Because one thing I find that when we go to the doctor, we expect that when we give the doctor a few things, that they're automatically going to give us an exact diagnosis. But you can't get an exact diagnosis when you're not giving exact symptoms. How long it's happened? How long have you noticed it? Is it certain times? All of these things allow you to get an exact diagnosis, to get a diagnosis of clarity, get a great plan of care, and then get treatment options. So I want to make sure that we know when we are going to our PCPs, when we're going to our doctor. I told you, PCP is not just primary care physician. No, it's physician, that's expert advice, collaboration, what you're doing together, and partnership. You are in partnership with your physician, not a silent partner, but an active partner. So if you're giving all your information, you can expect and believe that your physician is going to give you expert advice so that you can live your best life. So please do not forget that the Moffitt Cancer Center is one of the top 10 hospitals, cancer hospitals in the nation. They're based in Florida, but they have a lot of information on their website, a lot of clinical trials, research. And if they are one of the top 10, I'm sure they know about the other 9. So don't worry about where you live. It's most important to get that information. And I'm sure that they can let you know where there are experts. Hey, Roxanne, where there are experts that can tell you about this condition in the city or state that where you are, where you reside right now. So there's a lot of things going on in September as far as Awareness Month. And you're probably thinking, why are we getting all this information? Because it might not be you today, but it could be someone that you love and care for tomorrow. So isn't it awesome to be able to know, to refer, and to tell somebody, to be able to say, other than I'm sorry, but you could say, you know what I know, you know what I heard, why don't you call this hospital? Why don't you look them up? They're one of the top 10 cancer centers, and I'm sure they can give you more information. So that's what we do every day, and that's why Angie's Pace exists, because I want to make myself a committee of one, that I can give out information that I might not necessarily need, but someone somewhere that someone else knows can tell them and spread the word. That's what we want to do. We want to give out good information, and then we want you, our listeners, and the people that come every day to share that information. So today, where our topic was leukemia and lymphoma. Those are the blood cancers. Hematologists all over the world are working for the advancement, so one day we can say that we have a cure for that. So hey, thank you for joining me. I'm Angela McGowan, your professional healthcare advocate, caregiver strategist, and I help you navigate through healthcare's sea of red tape and create strategies that will allow you to give excellent care to those that you love and care for, as you care for yourself as well. So always in part, I'm leaving you with those 2 things: blessings and joy. Why? Because they both belong to you. Thanks for joining me. I'll see you again tomorrow at 9:05. Have a blessed day and happy Monday. Bye.